Okay, well, we have a great case here. This is a typical case that we would see in most general practices. It's one that I think that we should be doing extremely well. So I'd like to take a closer look at this. With permission, of course, I would like to be a little bit critical of the implant plan and what we look at. The first thing I look at when I see a case like this is I want to make a determination. What kind of guide can we do? And the answer should be very quick. We should do a OptiGuide here. Now, OptiGuide can be done again with or without CEREC. If you have a CEREC machine, obviously you take a digital impression, we'll merge the data together to produce a digital mill guide. If we do not have CEREC, we will simply send a impression stone model along with the data set, and CCAT will convert that into a digital impression and then mill the surgical guide. The advantage being the not needing to scan the patient a second time with the bite plate. So in this particular case, let's take a close look here. So the nice thing here is first and foremost is that we have a good impression of the overall arch. Again, it's not necessary to have the entire arch. Ideally, for an OptiGuide, in this particular case, we would go to at least, not maximum, but at least tooth number 11, and we can see here we've gone all the way across, which produces a guide that has good cross arch stability, and this is ideal. I really encourage us to always use a full arch scan for the OptiGuides. Now let's go to our implant align view, and we'll take a look at our implant plan here. So the first thing I'm going to do is go ahead and move my axial over here to go ahead and get to the occlusal plane. And we're going to take a look. Now, I've had the benefit of seeing the post-op result of this particular implant, and it caused me to want to have the DICOM data sent to me. So let's go through our checklist. Number one, let's look at the buccolingual positioning, and the implant is centered extremely well in the bone. We have plenty of adequate bone around. My first question from this particular view right here would be, could we go longer? So, my preference is to do a longer implant here, but in doing a longer implant, we can see here it looks fine, but right here, it looks like we're right up against the sinus. But for the time being, let's go ahead and move it back to where we were. The next thing we're going to look at, mesiodistally. Mesiodistally, always centered between the roots. Is there adequate space between the roots? And the answer is, of course, yes. So we're looking very good there. Let's move ahead here. We'll take a look. Are we coming through? Is the occlusal plane level here? And the answer is pretty much yes. If we were to be a little critical, we could say maybe that's a little bit better. But again, this is very, very good. I have no issues here. Two, on the occlusal table itself, we can see that this implant is coming out of the center of the tooth, supporting through the central groove, literally perfect. I mean, this should be a simple place. And the other thing I notice here is that we can do a screw retained restoration, so I'm already planning that in my head. Now, what about bone level? Let's go to vital structures, anatomical structures. And in this particular case, in the upper, we're really dealing with the sinus. So in this particular case, I have no issues. Personally, I would be very comfortable doing 11.5 millimeter implant here, engaging into that cortical plate of the sinus, maybe even making a small perforation. Shouldn't be that big of an issue, but I'm totally very comfortable with the desire to avoid that. Okay. But it's also going to bring me to my next point here, and that is bone level. And we can see here that we're following the general rule of 3 millimeters below, but let's remove this sign and let's go right here. So if we actually look at this right here, I understand where we're coming from on this, but I prefer to mainly, in these particular cases, I don't like the implant depth here. I think this is a hair too deep. So in an ideal world, I would probably have this implant placed about right there. So again, let me show you the difference. This is the plan placement. So what I would like to do is I'm going to duplicate this plan and call it T-bone. So now we have a second plan here, okay? And then I'm going to go ahead and be free to adjust this, and I would probably plan this to be about right here, Now, you may say, well, that's outside of the bone. I would say, listen, that's on the palate. That's very thick tissue there. It's non-aesthetic. That's okay. My concern with putting the implant deep is going to be getting the componentry on here, being able to build the emergence profile around the bone, possibly having to adjust some bone here to be able to adjust some bone to get the component seated and or get our restoration and or abutment seated. So I would be a little more leery of that, and I think probably something like that is a little bit of a better position. I would not at all hesitate with slightly being out of the bone right there. So you know, that's my only critique of this particular plan. And the other thing that allows us to do, if you notice, is now we can come in and get a longer implant and still avoid the sinus there. So again, I would have some concern with the depth of the placement there. If you can take a look here. Here we can see that visually I'm just below the crest of the bone here, whereas on our original plan we are quite a bit below the crest of the bone. Again, this will be totally workable, will produce an excellent result with the use of a conical connection platform switch, minimizing the abutment connections. We will maintain that bone around that implant, but I would prefer to be more in this realm right here. So again, very well done. Last check, we'll go through 360 to make sure there's no major issues. Slam dunk, slam dunk, slam dunk. Great job. You know, this is the kind of cases that we should all be doing on a daily basis, and with complete confidence and moving forward. So kudos, and just again, we learn by looking at our work and being critical, and I have zero issues with this, and fantastic. Thank you.